America's addiction to opioids, a silent but deadly killer. Did you know that opioid addiction increased 3 times in the past 29 years? Approximately 2 million Americans abused or were dependent on opioid prescription painkillers, and nearly 400,000 people abused or were dependent on heroin. The estimated number of emergency department visits involving non-medical use of opioid analgesics increased from 144,600 in 2004 to 305,900 in 2008. So what are opioids? Opioids are a group of drugs that are used for treating pain. They are derived from opium, which comes from a poppy plant. Opiates go by a variety of names, including opiates, opioids, and narcotics. Opioids produce a sense of well-being or euphoria that can be addictive to some people, but are legitimately used for treating pain. When used for pain relief, many people develop tolerance, meaning they need more and more to get the same effect. Some people go on to develop an addiction to opioids. They begin to obsessively think about getting more opioids and in some cases engage in illegal activities such as double doctoring. The signs and symptoms of opioid abuse are multifaceted. The physical signs that someone might be abusing an opioid include noticeable elation and euphoria, marked sedation and drowsiness, confusion, constricted pupils, slowed breathing, intermittent nodding off or loss of consciousness, and constipation. Other signs of opioid abuse include doctor shopping, getting multiple prescriptions from different doctors, shifting or dramatically changing in moods, extra pill bottles turning up in the trash, social withdrawal and isolation, and sudden financial problems. Opioid addiction does not discriminate. A profile of an opioid addict can be male or female, young or old, college degree, high school diploma, or non-graduate. Socioeconomic status is not a factor, whereas an opioid addict can be wealthy, middle class, or lower class. Could live in a city, suburban area, or even the rural area. The ethnic diversity could be black, white, Asian, or any other ethnic background. An opioid addict is somebody who needs help and is not discriminant against the language they speak, the financial means in their pocket, or the color of their skin.
The risks of opioid addiction are that a high dose of opiates can cause death from cardiac or respiratory arrest. Tolerance to the euphoric effect of opiates develops faster than tolerance to the dangerous effects. Therefore, people often overdose by mistake because they are trying to get a higher high and take too much. In 2014, the rate of drug overdose deaths involving natural and semi-synthetic opioids were 3.8 per 100,000, and that was the highest among opioid overdose deaths. Whereas in 2013, it increased from 9% from 3.5 per 100,000. The withdrawal effects of opioid addiction are physically and psychologically debilitating. Opiate withdrawal symptoms can last anywhere from 1 week to 1 month. Early symptoms of withdrawal include agitation, anxiety, muscle aches, increased tearing, insomnia. Late symptoms of withdrawal include abdominal cramping, diarrhea, dilated pupils, nausea, and vomiting.
The main types of medication to treat withdrawal symptoms are methadone, buprenorphine, clonidine, and naltrexone. Methadone relieves withdrawal symptoms and helps with detox. It is also used as a long-term maintenance medicine for opioid dependence. This helps reduce the intensity of withdrawal symptoms. Some people stay on methadone for years. Anyone going through detox for opioids should be checking for depression and other mental illnesses. Treating these disorders can reduce the risk of relapse. Antidepressant medications should be given as needed.
So, what now? An effective primary prevention method and intervention would be to provide education not only for those that are in school, but for those that are in the community as a whole. This can be done through educational seminars held at a community forum or posting flyers and advertisements around the community as a whole. An effective secondary prevention method and intervention would be the implementation of holistic medicine, which aids to the person's mind, body, and spirit and lessens the use of opioid or medical treatment. This type of holistic medicine includes acupuncture, meditation, and spiritual treatment that has shown improvement in patients' chronic pain and therefore decreases their use and addiction as well as dependence on opioids for pain relief.